All right, everyone, it's the top of the hour. We'll get started. I'd like to welcome everyone to today's GlomCon. Today is one of our clinical trials, conference series, which is a joint venture between GlomCon and NephCure. And today's title is APOL1, a story from bench to bedside. So before we begin, I just want to bring up NephCure, our partner in this series, where their mission is to accelerate research and effective treatments for rare forms of nephrotic syndrome and to educate and support to improve the lives of those affected by protein-spilling kidney disease. One of their resources they have is the Kidney Health Gateway, where physicians, patients, family members can look for clinical trials that may be going on in their area to help us get patients into trials, patients to participate in trials, and advance our understanding and treatment for our patients and their kidney disease. So today we are excited to have our speakers and panelists with us. Our speaker today is Dr. Stacy Johnson. She is on the clinical development team at Vertex Pharmaceuticals, working to develop therapeutic interventions for APOL1 mediated kidney disease. She received her MD and PhD from Baylor College of Medicine in Houston and completed her internal medicine residency and nephrology fellowship at Duke University. Dr. Johnson was most recently an assistant professor at the University of Tennessee Health Science Center in Memphis. And in June this year, she left to join the APOL1 mediated kidney disease team and lead here at Vertex. Our panelists today are Dr. Susanne Nicholas. She is a tenured professor of medicine at the David Geffen School of Medicine at UCLA. She received her medical degree from the University of California, San Diego, master's in public health from San Diego State University, and a PhD from the University of California, Los Angeles. Her primary research interests are to understand and identify key factors to promote the pathogenic medicines of diabetic kidney disease, uncover and validate novel therapeutic targets, and predictive biomarkers of diabetic kidney disease, and also perform population studies and disparities in chronic kidney disease and CKD health. She has served numerous leadership positions, both locally, nationally, and internationally, has numerous publications, and has served as mentorship for many, and received many awards for all of her work that she's done. So we're excited to have her here. Our other panelist is Dr. Jeffrey Kopp. He is the chief of kidney disease branch of the National Institute of Diabetes, Digestive, and Kidney Disease in Bethesda, Maryland. Was educated at Harvard and the University of Pennsylvania Medical School and received his training at the University of Washington. His research interest lies in the pathogenesis and treatment of FSGS, and his genetic studies have contributed to the identification of APOL1 as a major susceptibility gene for kidney disease in African Americans. He has numerous publications and holds a commission in the United States Public Health Service with the rank of captain. I'm Dia Waguespack at McGovern Medical School in Houston, and I will be moderating along with Joshua Tarnoff, our the Chief Executive Officer of NephCure Kidney International. So with all of that, we're excited to have everyone here today. We will get started. We'll start with Dr. Johnson. We'll do a presentation, and then we encourage everyone to ask questions in the chat, and we'll have a discussion afterwards for the remainder of the session. So with that, I will stop sharing, and Dr. Johnson will let you share your screen.
Okay, thank you very much, Dia. Okay, let me go to the slideshow. Okay, you guys see the slide?
Yes.
Perfect, thank you.
Looks good, thank you.
Hello, everyone. I know for some of you it's the morning, and for some of you it's the afternoon, so I'll say good day. And thank you so much for allowing me to be a part of this panel and to tell you a little bit about what's happening with APOL1 mediated disease at Vertex. For today's talk, I'll go over some of the genetics and mechanisms of disease of APOL1 mediated kidney disease, or AMKD. I'll also talk about the spectrum of clinical presentation for APOL1 mediated kidney disease and its clinical impact, and address the importance of genetic testing for APOL1, and also talk a little bit about Vertex's APOL1 screening study,